Hello, my name is Dr. Pinar Polat, and I am an associate professor in the Sleep Clinic, part of the Breathing Institute at the Children's Hospital of Colorado. My background is in child neurology, and I will be talking to you today about sleep in children with autism spectrum disorder. Sleep difficulties are common in children and adolescents with autism spectrum disorders, with an estimated prevalence of 50 to 80%. This is important because disrupted sleep is associated with a number of daytime symptoms as well as parental sleep disruption and stress. In children with autism spectrum disorder and disrupted sleep, daytime symptoms include hyperactivity, increased repetitive and self-stimulatory behaviors, sensory issues, anxiety, and aggression. The relationship between autism and sleep is bidirectional. Children with autism spectrum disorder have a higher prevalence of sleep difficulties compared to typically developing children, while poor sleep worsens some features of autism spectrum disorder, such as sensory difficulties and anxiety. The most common sleep difficulties in children with autism spectrum disorder include delayed sleep onset, frequent nocturnal awakenings, reduced sleep duration, and early morning awakenings. Children and adolescents with autism spectrum disorder typically have shorter duration of REM sleep, which is important for learning and memory consolidation, and an increased proportion of stage 1 or light sleep, which is indicative of sleep fragmentation and poor sleep quality. Causes of sleep difficulties in children with autism spectrum disorder are often multifactorial. Behavioral causes of sleep difficulties that are common to typically developing children, such as inadequate sleep hygiene and bedtime resistance, can be present in addition to challenges that are unique to autism spectrum disorder, such as difficulty with transitions, communication impairment, and sensory processing issues. Children with autism spectrum disorder may have abnormal melatonin production, as well as impaired GABA and serotonin transmission, which are neurotransmitters involved in establishing and maintaining a regular sleep-wake cycle. Studies show some children with autism spectrum disorder have mutations in clock genes, which control our circadian rhythm and sleep-wake cycles. In addition, commonly co-occurring medical conditions such as anxiety, ADHD, GERD, constipation, and epilepsy can all disrupt sleep. With such variable causes, identifying and treating sleep difficulties in children with autism spectrum disorder can be challenging. A focus on early assessment of sleep in children with autism spectrum disorder through a combination of history, sleep diaries, and actigraphy when available is important. Actigraphy is a study in which an actigraph device, similar to a Fitbit, is worn on the wrist to record movements and light exposure, which is then used to estimate sleep-wake patterns. A sleep history should include an assessment of typical bedtime routines, environmental factors such as co-sleeping or whether patient shares a room with a sibling, underlying medical problems such as GI issues and epilepsy, and screening for sleep disorders such as obstructive sleep apnea and restless leg syndrome. If there are symptoms suggestive of obstructive sleep apnea or periodic limb movements of sleep, a polysomnogram or sleep study should be obtained. Treatment of sleep difficulties in children with autism spectrum disorder includes addressing primary sleep problems such as obstructive sleep apnea or restless leg syndrome if present, addressing other medical conditions that may be contributing to sleep difficulties such as GERD or anxiety, establishing healthy sleep habits and routines, addressing environmental barriers to sleep such as noise levels and visual stimuli, behavioral therapy for sleep, and pharmacotherapy. Optimizing sleep hygiene and behavioral therapy are considered first-line treatments when addressing sleep disorders such as sleep initiation and maintenance insomnia and frequent nocturnal awakenings. Behavioral therapies are effective in a majority of children with autism spectrum disorder. Important initial strategies include exercising during the day, limiting exposure to digital screens and loud noises approximately 1 hour prior to bedtime, establishing a regular sleep routine and maintaining a consistent sleep-wake schedule, including on weekends, and limiting caffeine consumption, especially in the afternoon and evenings. Visual cues such as bedtime schedule poster are especially effective for children with autism spectrum disorder as they can help them anticipate next steps. If the child or adolescent is not responsive to sleep hygiene and behavioral therapies alone, medications may be considered. It is important to note that children with autism spectrum disorder are more likely to be prescribed medications for sleep compared to typically developing children. One study by Mallow found that in children ages 4 to 10 with autism spectrum disorder and sleep diagnoses, 46% were taking at least one medication for sleep. This is compared to 23% of typically developing children with sleep diagnoses. First-line pharmacological therapy includes melatonin. Studies show that melatonin at doses of 1 to 3 milligrams was effective in decreasing sleep onset latency, improvement of daytime behaviors, and decreasing parenting stress. Other pharmacological agents typically used to treat insomnia in children with autism spectrum disorder include clonidine, Melatonin, and gabapentin. In our sleep clinic at the Children's Hospital of Colorado, we have both medical providers and sleep psychologists to holistically address sleep concerns. As of almost 1 year ago, we have a new clinic called COMETS, which stands for Collaborative Opportunities to Maximize Effective Treatment of Sleep clinic, during which patients and families meet with both a medical provider and a sleep psychologist during the same visit. This clinic model allows us to address both medical and behavioral sleep concerns at the same time. It also allows medical providers and sleep psychologists to collaborate in real time to achieving the family's desired sleep goals. So for example, for a 7-year-old child with autism spectrum disorder and sleep onset insomnia, the medical provider will manage pharmacotherapy, while the sleep psychologist will address behavioral strategies during the same clinic visit. This also saves the family a considerable amount of time and demonstrates the equal importance of both medical and behavioral treatment modalities when addressing certain sleep difficulties such as insomnia. So far, we have received very positive feedback from families regarding this clinical model. To summarize, sleep difficulties are common in children with autism spectrum disorder and can be considered a hallmark feature. Poor sleep impacts a child's daytime functioning as well as parent stress levels. Therefore, screening for sleep issues and addressing them with appropriate therapies is important for the well-being of children with autism spectrum disorder and their families. For more information, please visit our website.